Gather all materials needed for this assessment, like stethoscope, thermometer, sphygmomanometer, cotton balls, alcohol. Wash hands before starting the procedure. Washing hands can keep you healthy and prevent the spread of respiratory and diarrheal infections from one person to the next. Germs can spread from other people or surfaces when you touch your eyes, nose, and mouth with unwashed hands.
And your birthday, please?
January 27, 2003.
So today I'm gonna take your vital signs, which contains 4 elements: the temperature, the pulse rate, the respiratory rate, and the blood pressure. So vital signs monitoring is crucial for health and long-lasting life. It signals early signs of infection. It prevents misdiagnosis and it detects symptoms less medical problems. So, is it okay for me to take your vital signs?
Yes.
Adjust the lighting, close the door and the curtains for the patient to be more comfortable.
So, I'm gonna start by taking your oral temperature. So, raise your thumb.
Place the thermometer on the oral area and wait for the appropriate amount of time.
Your temperature is 37.3 degrees Celsius.
After using it, wipe the thermometer correctly and use a new one for the auxiliary area. Document the data collected. Use alcohol to sanitize your hand.
Now I'm gonna take your temperature in your auxiliary area. So is it okay for me to take your temperature?
Yes.
While taking your temperature, I'm gonna take your radial pulse.
Select the pulse point and position client accordingly. Count pulse to 30 seconds, then multiply it by 2 by using wristwatch with the second hand. After taking the pulse rate, observe the chest movement while taking the radial pulse. Count pulse rate for 1 minute.
Your temperature is 36.1 degrees Celsius.
Wipe the thermometer with cotton that has alcohol from stem to bulb.
And your beats per minute is 86 beats per minute.
Document the reading of body temperature, pulse rate, and respiratory rate. Use alcohol to kill bacteria.
Good day, sir. My name is Harvan Amaran and I will be your student nurse. Please state your name, sir.
My name is Morris Galmamorado.
Your birthday, please.
January 27, 2003.
Sa mga nakaraang minuto po, kumain po ba?
Hindi po.
Tumakbo po ba?
Hindi po.
Naglakan?
Hindi po.
Use alcohol to sanitize your hands before starting the procedure.
So what I'm gonna do is I'm gonna take your blood pressure. So blood pressure taking is very important for you to have a clear picture of the possible risk of you having heart disease or stroke.
Don't forget to ask if the patient still remember his past blood pressure. In this case, the patient does not remember his past blood pressure. So I will add 30 to his systolic blood pressure.
What I'm gonna do is I'm gonna put the cuff on the upper hand, on the upper arm of your brachial artery. It has to be 1 inch. Now I'm gonna start counting. Make sure that the cuff is inflated.
Inflate cuff 30 mm of mercury above the normal systolic reading of the client. Release the valve of the cuff carefully so that the pressure decreases at the rate of 2 to 3 mm of mercury per second. Remove cuff and inform the client of reading.
Your blood pressure is 110 over 75. Let me try another procedure. But this time I will use my 2 fingers to determine the system. Relax.
Wait for 2 minutes or use the other arm to take your second reading.
Again, make sure that the cuff is deflated. is 110 over 75. And it is within the normal range.
Document pertinent data. Again, use alcohol to sanitize your hand.
So now I'm gonna indicate your result. So your name is Maurice Jalma Maradlo. You are 19 years old, born on January 27, 2003. Your oral temperature is 37.3 degrees Celsius. Your auxiliary temperature is 36.1 degrees Celsius. Then your pulse rate is 86 beat per minute, which is normal. Then your peripheral pulse radial, pulse rhythm regular. That means you have no signs of tachycardia and bradycardia. Your respiratory rate is 17 beats per minute. It is within the normal rate. Then it also means that you have no signs of tachypnea, bradypnea, and apnea. Your blood pressure is 110 over 70.